Hello all, welcome back to my channel. I am Dr. Sonia Musakutti and today in my video I will be dealing with the complications of orofacial infections. So before going into the topic, please don't forget to subscribe my channel and like this video. So the complications of orofacial infections can be broadly classified into two types, that is those related to the lower jaw and those related to the upper jaw. The complications which are related to the lower jaw include Ludwig's angina, descending deep cellulitis of the neck which results in mediastinitis, then there is carotid sheath invasion. The complications which are related to the upper jaw include intracranial complications with possibilities of cavernous sinus thrombosis, brain abscesses, dural meningitis and osteomyelitis of the skull, and retrobulbar cellulitis with possibility of blindness. The most common complication of orofacial infection include the Ludwig's angina. So in this video I will be concentrating more on this topic. So what is actually Ludwig's angina? It is a name which is given to a massive, firm, browny cellulitis or induration and acute toxic stage involving simultaneously the submandibular, sublingual and submental spaces bilaterally. Next, we can go through the etiology of Ludwig's angina. This includes odontogenic causes, acute dentoalveolar abscess, acute periodontal abscess, acute pericoronal abscess. Then iatrogenic causes like use of a contaminated needle for giving a local anesthesia, then traumatic injuries to the orofacial region, submandibular and sublingual cell adenitis, secondary infections of oral malignancies or any miscellaneous causes. Next is the microbiology. A variety of microorganisms has been implicated as a causative agents for this condition. The microorganisms include the presence of staphylococci, streptococci, gram-negative enteric microorganisms such as E. coli and Pseudomonas, and anaerobes including bacterioids, anaerobic streptococci, peptostreptococcus and fusospirochetes. So next we can go through the clinical features of the Ludwig's angina. The clinical features are of two types, the general symptoms and the regional symptoms. In general examination, it includes general constitutional symptoms like the patient may look toxic, very ill and dehydrated. There is pyrexia, anorexia, chills and malaise. There is difficulty in swallowing, that is dysphagia, and impaired speech and hoarseness of the voice. The regional symptoms may include both extraoral and intraoral findings. Extraorally, the swelling is seen in the bilateral, submandibular and submental region, which soon extends down the anterior part of the neck to the clavicles. The characteristics of the swelling include the swelling is firm or hard browny, that is broad-like or woody hard, and the swelling is non-pitting, it is non-fluctuant, with severe tenderness. The swelling shows ill-defined borders with induration. The patient may experience severe muscle spasm which may lead to trismus with restricted mouth opening and also jaw movements. Typically, the mouth remains open due to the edema of the sublingual tissues leading to raised tongue almost touching the palatal wall. In extreme circumstances, the tongue may actually protrude from the mouth and the tongue movements are reduced. There might be airway obstruction due to this. Respiratory rate may be seen to be raised and there may be dilation of alveoli. Cyanosis may occur due to the progressive hypoxia. There might be fatal death in case of untreated Ludwig's angina within 10 to 24 hours due to aphaxia. Now comes the intraoral findings. The swelling which develops rapidly involves the sublingual tissues and it distends or raises the floor of the mouth. There will be woody edema of the floor of the mouth and tongue. The tongue may be raised against the palate, increased salivation, stiffness of the tongue movements, difficulty in swallowing, backward spread of infection which leads to edema of the glottis resulting in respiratory obstruction or embarrassment. Stridor is the alarming sign of this fatal extension needing emergency intervention to keep the airway patent. Now we can discuss the principles of treatment for this Ludwig's angina. Ludwig's angina is a life-threatening emergency situation and it is best treated by aggressive intervention. So, the treatment is based on the combination of the following factors like early diagnosis, maintenance of patent airway, intense and prolonged antibiotic therapy, extraction of the offending teeth, and surgical drainage or decompression of the facial spaces. So, the first principle of treatment is the airway maintenance. It is very important to assess the airway of the patient. Death can occur from asphyxia rather than the infection itself, leading to septicemia and shock. So, in such conditions, it is necessary to intubate the patient. Nasoendotracheal intubation is more commonly preferred. In severe cases of upper respiratory obstruction, surgical airway maintenance like laryngotomy, cricothyroidotomy are always preferred. So next comes the surgical intervention. There are mainly two aims for doing the surgery, that is for removing the cause of infection and for surgical decompression. Removing of the offending tooth may facilitate the evacuation of the pus. Surgical decompression is done by bilateral submandibular incision and if required a midline submental incision 1 cm below the inferior border of the mandible are sufficient to drain the involved spaces. Next comes the antibiotic therapy. Antibiotics play a vital role in managing the Ludwig's angina. Usually IV antibiotics are necessary. So the antibiotics include penicillin and its derivatives like penicillin, semi-synthetic derivatives of penicillin, cloxacillin, and in case of allergy to the penicillin, erythromycin, gentamicin, clindamycin, metronidazole, cephalosporins are also given. So coming in detail about the penicillins. Penicillins are the first line of antibiotics in treating such infection as it covers the majority of the aerobic gram-positive microbial flora which is commonly associated with this Ludwig's angina. It is administered in the form of aqueous penicillin G, that is 2 to 4 million units, IV 4 to 6 hourly or 500 mg 6 hourly orally. Another type of treatment modality is the hydrotherapy. It is a debatable issue because it includes cold application in post-surgical cases of Ludwig's angina and it causes decrease in inflammation, decrease in exudates and decrease in swelling and edema formation. This hydrotherapy is usually given by placing a gauze pieces over the most indurated area and wetting them intermittently with cold water. Significant improvement from discomfort can be expected in the initial 48 hours. So that comes to an end of the topic Ludwig's angina. I am not going in detail about the other complications of orofacial infections because they are not so clinically relevant when compared to the Ludwig's angina. So I have made this topic of Ludwig's angina maximally short for easy revision and understanding. So I hope all of you found this video useful and interesting. Thank you.